And with a totally open process in June, and we'll see how it goes. But there's unfortunately, and this is another speech I gave about our representative democracy, can it survive? And the biggest problem in the House is gerrymandering. Gerrymandering leads to the polarization of the parties. I'm very rare to have a district that could be Republican or Democrat. There's maybe somewhere between 50 and 60 districts that can easily go one way or another. I've got one of them, Kurt Schrader has one, because we redistricted kind of honestly in Oregon, but in other states, Pennsylvania is a great example. They were down to, I think, 2 Democrats, even in the state after redistricting. Their Supreme Court just threw out that redistricting, and the Supreme Court drew the new maps, and now there's 7 Democrats, which represents the overall vote in the state, as opposed to states like Minnesota, where the Republicans get 51% of the vote in the state legislature and control 65% of the legislature because of artfully drawn maps on the state level, let alone the federal level. So in the House, that's part of the problem, is this partisanship. It used to be like, this would be a liberal Republican, this would be a conservative Democrat, and you have this whole area in between. Those lines don't even mean anymore.
Peter, I'd like to go back to healthcare for a minute and cost. Put in a plug for John Kitzhaber, who had cost control measures with his committee to essentially rate both procedures and diagnoses as to what would be covered. I don't hear much in the way of cost control measures except getting rid of insurance executives in the current ongoing discussion and plans. I wonder if you had a comment or answer the question as to how are we going to save some money there?
Well, number one, we are saving money, and that was quantified by a number of the experts who testified in my town halls this week in terms of extending preventative care and avoided costs. So that's key. And right now, everybody gets free preventative care under their insurance plan, whether they're in Medicare, Medicaid, or a private plan. That didn't exist before. If you wanted to have a colonoscopy and your doctor says, "Oh, time for a colonoscopy," "Oh, that's not covered. That's going to cost me $2,500. I think I'll skip it." And then you end up with colon cancer. So that was a major measure. There were other that were supposed to be, and there are. There were a number of qualitative measures also that were supposed to be tracked in terms of provision of care, and then incentives or penalties to hospitals that would meet those in terms of readmissions or not. So there's still some things that are extant that are cost controls, not great. But the average healthcare inflation has pretty well, it was going up really high, then we started considering the Affordable Care Act and kind of leveled off. And now it's going up more gradually, except for pharmaceuticals, which is a glaring example. Pharmaceuticals are far outpacing the rest of inflationary costs in medical care, and that's something that I think we're going to try and deal with next month. I personally, for years, have supported the government negotiating drug prices. Every other industrialized nation on earth does that. No matter what their healthcare system is, whether it's partially private, or single payer. Great Britain, Germany, they negotiate the drug prices, and then they get the health plans to buy the drugs for the patients, and they're paying significantly less than we are for their drugs. So that's one measure that is commonly talked about. Getting into limiting procedures that was part of the original Affordable Care Act, was to look at procedures and see whether or not those procedures, what the kinds of outcomes were, and or drugs, what the outcomes were. Unfortunately, most of that got defunded when we lost control, so we haven't done a lot of that, and we should be doing more of that. So. Yes?
Something that I've become aware of recently is the dangers with 5G technology. Has there been any consciousness or any talk in Washington about this issue and the dangers?
Well, the last FCC study was long before on electromagnetic radiation, was way before the invention of 5G or 4G or 3G. It was back in the 90s. So I have written to the Federal Communications Commission and asked for what data they're using to determine that it is safe, and asking whether they are looking at and pointing out that I think they should look at studies in the modern era, in this century, to assess the health effects. I'm also a sponsor of legislation. The reason this can go forward, even if the community objects, is the telecommunications deregulation of 1996. And I was one of 16 people to vote against it. And I said, I just don't like this. We preempted cities, we preempted counties from siting of both energy facilities in the Bush-Cheney entry policy. But then earlier than that, under the Gore-Clinton policy, we preempted communities from controlling the siting of cable or other electronic devices, essentially took them out of the equation. And that's a real problem, and also really limited their capability of getting any revenues out of the installation of, say, cable in a public right-of-way or that. So I'm on a bill that would roll back the latest FCC ruling, which even liberalizes that more and shortens the time period where a community gets to comment. And I'm working on a bill just to return us to the status quo ante, which is the local communities can have control over these things. If the community doesn't want it, they shouldn't be forced to have it. And personally, I'm fairly addicted to these devices, everybody is, but I don't see that we need to make a leap to 5G. And there are actually alternate technologies that apparently don't have the health effects that could speed up the system if you really have to be able to stream some gigantic file while you're walking down the street with your cell phone, as opposed to being at home and getting connected through the cable or satellite or however you're connected, or in my case up in East Springfield through the copper wire. So.
What information can you share about the impact of the administration's policy on immigration and how that is impacting the availability of farm workers and construction workers in Oregon and other places?
Well, I'd say the most evident impact is the whole chilling effect on any immigration or visas into the country, and I've heard most from higher education about the loss of student enrollment. I hear from the agriculture industry, when they come in, particularly the nursery industry, that it's having a major impact on their capability of getting workers. Forestry also has problems getting workers. I haven't heard so much from construction yet. There's sort of an ongoing dispute in construction, whether or not we need a lot of immigrant labor in construction, and whether or not Americans would take those jobs as opposed to picking strawberries in the field or other things like that. And I haven't seen a good economic summary by sector, but there are studies of how much it benefits the economy to have immigrants in the country, and the numbers are quite astounding. So it's obviously an ongoing debate. I mean, the problem has been a number of times, well, we had a comprehensive immigration reform bill, which would have, a number of years ago, which would have solved all these issues. It was tough, but it was fair, and it would have taken care of all the people who had been here by a certain date. They would have had to, undergo a background check. They'd have to pay fines. They would have to file. They would get a card that gave them legal status, but it wasn't a permanent status. And then 5 years, they go through the process again. 10 years, they could begin to get in line for citizenship. And the rationale for 10 years was there's a lot of people in Mexico and the Philippines who are on the list to legally come here, and they're waiting 10 or 12 years to do it. So the idea was if someone came here illegally, we're not going to jump ahead of everybody, but we're not going to throw them out either. That was a good bill. It would have passed in the House if the Republicans had allowed us to vote on it at that time. But they didn't. Right now, immigration has become an incredibly polarized issue, and they're having no rational discussion about it. I'm not sure whether the leadership plans on trying to move anything or not. We've tried a couple of times to deal with a subset, which is immigrant labor, and that, you know, but the problem is we've always in the Senate had problem getting protections for the labor so that the labor can't be exploited if they're coming in as seasonal workers. But it would solve part of the illegal immigrant problem. Well, now we're having more of a problem with asylum seekers than we are with people who are coming in illegally to work. But if we could have a program where they got full protection of labor laws and treatment as they came here and worked, and they could come and go, that would solve a lot of the problem, because a lot of people come here, work, and send the money home, but they would be just as happy to go home when they're not harvesting and then come back the next harvest season. But after they have paid a smuggler to cross the border the first time, they can't go back. So we're doing a lot of things that are stupid. Yes.
I want to talk about transportation, which I think you have some influence on, or hopefully can. I just recently came down from Portland, and it only cost $350 on a plane, and we had a little snow thing here, making it difficult, and having to stay in Portland was unreasonable. But anything where you do it at the last minute, you pay an arm and a leg, and otherwise you pay just a finger. There's a difference, and I've asked people what they paid and what I paid. For $350 for 20 minutes on an airplane is not right. The trains sit on the track while the traffic goes through, and the people sit there. We don't have our own rails, and I just think we're kind of behind, and we need to get where we should be with both our planes and our trains. Can you help us out?
Well, I can tell you what I'm working on. First off, many, many years ago, I've been doing this a long time, a guy named Al Swift from Washington State was on transportation appropriations. I was on transportation. I was relatively junior. It was 1995. And we decided to put up the potential for high-speed rail and designate 6 high-speed railroads for the United States. And Oregon was part of one of those 6 routes back in the mid-90s, and that route was to go from Eugene to Vancouver, BC. Washington has put a fair amount of money into this on their side. Oregon has done nothing. We've done a little bit through Connect Oregon in terms of a couple of sidings and a few grade crossings, but you have to deal with the grade crossings, you have to deal with sidings for the freight or the passenger. Oregon has been working on deciding what the route would be since 1995, and I keep hearing they're close to making a decision. That was why they couldn't apply for funds under the Recovery Act for high or higher speed. I'm calling it higher speed because it's not going to be like Shinkansen or TGV, but if it could be dependable. Anyway, Oregon's getting close to apparently choosing a route, and then I will help work on that with them as we go through a service transportation bill and allocate funds. But the other thing I'm doing shorter term is Amtrak has a president who I think is doing a really great job, new president. He used to run Delta Airlines. And he's trying to bring Amtrak into the 20th century. It'd be too big of a shock to come to the 21st. But he's trying to move into the 20th century. And I mean, when he came in to see me first, he showed me he had a pass, he could go up in a locomotive, he was proud of that. And then he pulls out his iPhone, he says, I've got this, and he says, oh, I also have these. And he pulls out a key ring of skeleton keys. He said, when's the last time you saw a skeleton key? And I said, when I was a kid. So anyway, the thing is, as you pointed out, we don't own the right-of-way, except we own a substantial amount of right-of-way on the East Coast because of a railroad that went bankrupt. But we had, Congress mandated that freight had to give preference to passenger trains, and unfortunately it got litigated and was overturned in court. So we have to reinstate that rule, because since then the on-time performance has just gone in the tank. And what I said to Richard, I said, look, if you could tell me that dependably I could get to Portland from Eugene in 2 hours, I would never get on I-5 again. Because I mean, when I drove down last weekend, there was something happened just north of Corvallis, a car fire, it was, you know, it was almost 3 hours to get here. So he's actually working on that, because he managed to negotiate successfully on the Crescent route, which is being pushed by, I think, Senator Wicker, who's one of my compatriots on the Senate side, and he controls part of the jurisdiction of my committee. My jurisdiction of my committee is in 4 committees on the Senate side, but he controls rail. And so Amtrak was working to please him. He wanted more dependability, and CSX said, yeah, well, you can do it, but it's going to cost you, you know, I think the number was somewhere around $1.2 billion. We're going to do all this work. And Richard said, well, look, could you like give me your schedules and that, and just have my people look this over? And CSX did. And after his people, the new people he's brought in, went over it, they said, no, all we need is like 3 sidings. And they can do it for $84 million. And they will get the times they want. And so CSX said, okay, if you'll pay us $84 million, we'll build the sidings and we'll run it that way. So hopefully we will be able to, I'm hoping he's going to find the same solutions for here to Portland. And I'm hoping Oregon will also choose a route for the future, and then we can move forward. Planes, you know, they're deregulated a long time ago, and you know, in terms of their fares, they make more money now in ancillary fees than they do tickets, change fees and that. And the reason in part they do that is because those things aren't taxed. We run the system with a ticket tax, but the ancillary fees aren't taxed, so it's gravy for them. You know, that's something that I'm going to be working on, and a number of other issues that go to passenger and consumer rights. I just had to spend the last 3 years in the minority blocking the airlines from taking over air traffic control in the United States of America, which is what they wanted to do, and my chairman wanted to help them do it. And from the minority, I managed to block that, and that would have been a disaster for general aviation and for passengers and everybody else, because they would have removed the ticket tax that pays for the system. That was part of the bill, 7.5% on every ticket. And then they would have decided what new fee to charge you, and they would have taken that 7.5%, which is $11 billion a year, into their profits. So I've just had sort of a major confrontation and victory with the airlines, but I'll see what else I can do.
In my lifetime and yours?
It took me 32 years to get to be chairman, so I'm not sure about our lifetimes of getting this stuff done.
Hi, I think I need a refresher course on what a single-payer system means. You've referred to the insurance exchanges, and I've kind of lost my way on what they're advocating right now.
Well, single payer could take different forms, as envisioned by most people here. It would be something like Medicare for All, where there's one set of rules, one set of reimbursements, you know, that's greatly simplified from the current system. The physicians and hospitals would still either be public or private, whatever they are now. It wouldn't change that. It wouldn't be like the British system where most providers work for the state itself. It would be, you know, so you would still have, you know, publicly and privately run hospitals, or non-profit publicly and privately run for-profit hospitals. You would still have physicians working in different groups that relate different ways, but the insurance plans would be uniform, so that they wouldn't have to employ a whole bunch of people. I was interviewing the Sites-Law News last week or this week, I can't remember, if I'm traveling around this week, and one reporter got really upset. He said, well, what are you going to do with all those people who process the claims and the bills now? He says, they're all going to be unemployed. And I said, well, maybe we can you know, help them out with retraining to become nurses, or because we have a nursing shortage or something like that. So, yeah.
Non-partisan question. Is there any congressional committee that's investigating the Russia hacking from the Russia end, disregarding Mr. Trump? For instance, there's one that has subpoenaed his tax records. Outside of the Mueller follow-up, looking for the ISP addresses and or in and out phone numbers of every tabulator in every state, especially the ones that the electoral college votes, like the 3 or 4, Ohio and Wisconsin and so on. Does anyone, because the NSA's whole reason to be is metadata, which is who called, particularly from Moscow, to the Ohio tabulator. And that would kind of tell us if they directly hacked the vote. And it would be cool if it also incidentally caught the National Republican Committee or even the Democrats doing that hacking.
Well, what we need is a system that can't be hacked, and that's pretty simple. That's the Oregon system. There is a paper trail. I think there's still, and I don't have the number at the top of my head, but there's I think 12 or 13 states that still don't have paper trails. So you've got to worry about the systems. There were some strange anomalies in the election in Ohio, in Bush v. Gore that were investigated, never conclusively proven. But that's a proprietary software written by a company owned by a right-wing guy. So, I just don't think there should ever be a totally electronic system. That's part of the reform when we passed H.R. 1. It was a mandate every state have a paper trail. So you could not have an electronic system. The Intelligence Committee under Adam Schiff is spending a lot of time on these issues, the Russian influence and direct or indirect action taken by Russia. Most of the action that's come out so far was indirect but influential in terms of social media influencing people, doing essentially propaganda. So that I'm not aware that they have found any direct links into changing the vote, but they are looking very broadly and very deeply into those issues, and that's all going on. That's not. I could go to the secret room in the Capitol and I could review whatever they produced so far, but I'm busy with other things, and I'll let them do their work, and they come to a conclusion, then I'll find out.
I was just wondering if they could at least go after Russia, call for Moscow.
Well, we did, Trump was reluctant to impose any sanctions on Russia, and Congress did push for some minimal sanctions, but there should have been a lot more, and obviously.
But what I'm saying is, why do we even have an NSA if Moscow can hack into our nuclear plants as well as our voting, and have not waste the storage of all those ISP addresses coming in and out from Moscow? Years ago when we had Admiral, whatever his name was, under Bush, Poindexter, and he wanted to basically get every transaction and every movement of every American that was trackable, your credit card transaction, put it in a giant database and figure out something. And I said at the time, I think you're like 2 years behind on photo analysis for, secret facilities. I mean, what are you going to do with all this data? What's the algorithm, So anyway, there is some pointless gathering of data that is never evaluated, and I would question many times the effectiveness of our intelligence agencies. But again, I don't serve on that committee, so it's something that I'm not an expert on.
I don't mean to cut you short on this. We do have a proposed study at the state level for the Oregon League on cybersecurity and privacy today. I do care about this.
Right.
You mentioned in the context of transportation that you care about resiliency, and you have worked for a resiliency alarm system. And can you tell us what's new with that, and thank you for working on it?
Well, I traveled, I guess it's 2 years ago now, to Japan to learn from the experience of their tsunami and major earthquake. And one of the key things was that they didn't have deep ocean sensors. And so they had sensors they got the magnitude of the quake, and then they, from that, estimated the size of the tsunami. And when the waves hit their near shore sensors, they found out they were about 8 feet higher. So they had told people, if you're at 12 feet, or I can't remember now, but you're safe. Well, a whole lot of people sheltered in place at and they broadcast that. And then when the tsunami hit the closer buoys, they said, oh my God, those people are going to die. But the cell towers were all down and they had no way to communicate that they had new information. So the lessons learned were we need deep ocean sensors, we need a real-time system, we need resilient cell towers that have backup generation so we can transmit any changes so that we can continue to communicate. And I've been working on that. I just passed a bill in this Congress to say that the Federal Emergency Management Agency has to plan a comprehensive system for the West Coast. We passed that in the House. It hasn't come up in the Senate yet. And I have gotten a little bit of money over time. I've worked with the U of O and a consortium of universities, and we have deployed some sensors, but nowhere near what we need, and they're all land-based, and they're not going to help us with the tsunami issue. And you know, the more warning you have, there's a really interesting video clip, and it's they get a lot of earthquakes in Mexico City. They have a very elaborate system of sensors, and so they, wherever the fault is around Mexico City, they get the earliest warning, and the shock wave takes about 20 or 25 seconds or 30 seconds, I don't know exactly, to hit the mainly populated area. And it was in a TV studio, and the guy is like, the alarm had come through, and he said everybody should, get to a safe place now. He's saying you must run, get to a safe place, a tremor's coming. And everything's very calm, and then all of a sudden everything in the studio starts going like this after he's been talking for a little bit. So that's if you're very close. Where we're at, if we had deep ocean sensors, we could have maybe 3 to 5 minutes here. Portland would have 10 minutes. In Japan, they shut down everything. I mean, the elevators stop at a floor and the doors open. They shut down the Shinkansen. It doesn't move. They have like essentially an automated system to mitigate damage and loss of life. And that's one point. The other is for people on the Oregon coast, we've drawn lines now on the roads to say if you get over this line, you're safe, but how much time are you going to have to get there, and do you know the route? And we don't practice very much. So we are living on borrowed time, and we need to do a lot more of it, because this is going to happen sooner or later. Hopefully, I won't be here, but someone in this room probably will be here. Not. Anything else, Linda?
Well, I could ask you a question about redistricting. So leagues across the country are supporting a movement to get independent redistricting commissions. Essentially take it from the legislature to an independent commission. So there's some bills out there at the state legislature to do that, which are probably not going to move. Kevin Mannix has an initiative petition on the issue. I would call his proposal an independent commission. So what do you think?
Well, HR 1 mandated independent commissions for redistricting for Congress. We can't mandate what the states do for state legislature, but we would have mandated independent commissions for Congress, and we put certain conditions on what they would consider community of interest, compact, and a whole host of other criteria. What you got to watch out for is people have an agenda and are trying to sell you a bill of goods. Like our former secretary, recently deceased Secretary of State, wanted to have he wanted to have a commission that basically wasn't independent but was partisan. So you have to figure out how do you construct an independent commission? What are the criteria they have to use in creating districts? And I fully support that. You also have to watch out for other stupid ideas, like Phil Kiesling's idea that we should have a top 2 like they have in California. And I pointed out to Phil, I said, Phil, I have a swing district, and I know you come from Portland, and you Democrat can get elected even if they're dead. But in my district, that means I run 2 general elections a year, because I can't afford to come out second in the primary. So it would double the cost of running for office in districts that are truly swing districts. And then you get the perverse thing, which has happened in California, where you end up with 2 Republicans or 2 Democrats on the general election ballot, which doesn't make people really happy. What do you mean I don't get another choice? Oh, you can do a write-in. Oh, yeah, sure. And independent parties would never, ever be in a general election under that system. So it has been rejected. I think it was on the ballot. I can't remember a number of years ago we rejected it, and hopefully that won't come back. But But the independent commission to do away with gerrymandering would solve a lot of problems in the House of Representatives. It doesn't solve the Senate problem. The Senate problem is ultimately going to be bigger for this country than gerrymandering, because we can only solve it with a constitutional amendment. If you think about it, in Wyoming, a person gets 3 electoral votes. And there's 300,000 people less in Wyoming than my congressional district, and each of those people gets 3 electors. In my congressional district, you get 1 elector because you're representative, and then you have 2 senators, but 5 House members, so you get another 4. So you get 1.4 electoral votes if you live in my congressional district. You get 3 if you live in Wyoming. And by 2040, 35% of the people in America are going to elect a majority of the United States Senate. And it isn't going to be California, New York, Washington, or states like that. It's going to be Wyoming, Montana, Alaska, and all those states. And that is a huge potential looming problem. That's part of my very depressing speech, Our Representative Democracy Can It Survive, which perhaps I'll come and give some other time. Thanks very much. I appreciate it.